What is hyperopia? Hyperopia is a vision disorder that makes near vision tiring or even blurry, while distance vision is generally sharp. It's caused by an eye that is too short or a cornea that's too flat, insufficiently powerful to properly focus light onto the retina. Just a quick note, I'm using an AI voice for this video because I'm French and I'm a bit worried that my English accent might make things harder to understand. I hope you don't mind, and thank you for your understanding. What are the symptoms? Common symptoms of hyperopia include eye strain, headaches, difficulty reading up close or focusing. Children may also be restless or struggle to stay attentive at school. And by the way, if you're into this kind of topic, don't forget to subscribe. How is it diagnosed? Diagnosing hyperopia is done with a simple eye exam. The ophthalmologist tests your ability to see both near and far. A full assessment determines the degree of hyperopia. With children, it's more complex. We need to go beyond just measuring. We use specific eye drops, like Skyacol, to temporarily block accommodation and reveal the actual correction needed. How does it progress? In newborns, hyperopia is common and often decreases with growth. In some children, it persists. Others become myopic as their eyes lengthen too much. In adults, it may remain stable or become more noticeable when the eye can no longer compensate. That's when glasses become necessary. And it often gives rise to the myth, ever since I got glasses, my vision has worsened. The truth is, it's not the glasses. It's your eye that just can't do the work alone anymore. We'll dig into that in another video. How can it be corrected? Correction is simple. Converging glasses or contact lenses. In some adult cases, laser refractive surgery can be an option. In children, the eye can accommodate up to a point. But if the hyperopia is too strong or not corrected, it may lead to strabismus or amblyopia, when one eye fails to develop proper vision, even with glasses. That's why you may see kids wearing colorful patches over one eye. It's part of amblyopia treatment. If you have any questions, feel free to drop them in the comments. Why don't we notice it? The eye is an amazing machine. It compensates thanks to accommodation. In children, this can completely hide hyperopia. In adults, it gets tired, first for near vision, then eventually even for far. And the more severe the hyperopia, the harder it is to compensate. What's the daily impact? A hyperopic child may find it hard to concentrate, read, or stay calm. Some have learning difficulties because they can't sustain reading for long. For adults, uncorrected hyperopia makes visual tasks exhausting. Reading, using a screen, even driving. This kind of problem is very common but often misunderstood. Share this video with your friends. It could really help someone. Should glasses be worn all the time? If we choose to correct a child's hyperopia, the glasses must be worn all the time, except for sports or the shower. I'm half joking, but actually, some kids need them even for sports. Luckily, there are frames designed specifically for that. I might do a video about it soon. For adults, it's a bit different. It's really about comfort. If you enjoy headaches and eye irritation, then sure, skip your glasses. But for everyone else, I think you know what to do. Why does hyperopia cause eye strain? A perfect or properly corrected eye doesn't work to see far, but in a hyperopic eye, accommodation is already engaged even for distant vision. It's constantly working, like reading all day. This ongoing tension strains the eye muscles and the lens, especially when looking up close. That's where the pain, fatigue, and sometimes even dizziness come from. Can you drive without glasses if you have hyperopia? It depends on the degree of hyperopia. If it's mild and well compensated, it's usually fine. The key is having enough visual acuity to meet the legal driving standards. Only an eye exam can confirm that. Do screens make hyperopia worse? Screens don't directly cause hyperopia, but they can worsen symptoms like eye strain. That's why regular breaks and wearing your glasses are essential. And just so you know, when we're staring at a screen, we blink way less. That causes dry eyes, which can feel like visual fatigue. Irritation, blur, that gritty feeling. It's not true fatigue, but it feels the same. So remember to blink more often. Any tips for relief? Wear your glasses if you've been prescribed a correction. They help prevent eye strain. Don't wait for the headaches to hit before putting them on. It'll be too late. Glasses aren't a substitute for painkillers. And above all, get regular eye checkups, especially for children. Don't let issues like hyperopia go unnoticed. If you like this video, give it a thumbs up and turn on notifications so you don't miss the next one.
Prenez soin de vos yeux, à très bientôt. Ciao.